Good evening, everyone. We're so glad you all are here. My name is Nicole Rosenzweig, and I'm a first-year Duke Student Government Senator of Academic Affairs and co-chair of the Mental Health Caucus. We are thrilled to welcome you all to the second annual Mental Health Forum, the capstone event of Mental Health Awareness Week. Last year's Mental Health Forum was held in person in February, right before the pandemic hit and shook our reality. Given the particular importance and salience of mental health concerns this year, we felt this conversation was necessary now more than ever. One central goal of the forum is that student voices are heard in the process of improving mental health at Duke. We also aim to demystify Duke's mental health resources and foster greater transparency surrounding mental health and wellness. Our final goal is that some concrete ideas and solutions for the future of mental health at Duke come from this evening's discussions. With that, we're going to turn it over to our fantastic moderators who need little introduction. First, we have Olivia Liu, the co-president of Peer4U, a peer support organization at Duke, who's a current senior undergraduate student from Houston, Texas, studying chemistry with a minor in history. Next, we would like to welcome the president of Duke Graduate and Professional Student Government, Jay Lusk, a third-year student in the MD MBA program who graduated from Yale NUS College with a degree in life sciences before starting medical school. The moderators are going to start off by posing several questions to the panel, all of which were either submitted by Duke students from across the university or adapted from student-submitted questions. Finally, for the last 15 minutes or so of the forum, we will open up breakout rooms where you all can have open conversations with Duke administrators who work in the mental health and wellness space. Again, on behalf of myself and everyone who worked on this project, thank you for being here. We're looking forward to what comes out of the forum this evening. Now I'll pass it to Jay and Olivia to introduce our panelists.
Thank you so much, Nicole. We are so excited for everyone to be here, and we're so excited to introduce our panelists for tonight. First, we have Amy Powell, Vice Dean of Students and Director of Duke Reach. Dean Powell is originally from Virginia, and she came to the Dean of Students office after working in the Duke University Medical Center since 2000. Dean Powell received her undergraduate degree in psychology and sociology from Virginia Tech and a master's in social work from the University of North Carolina at Chapel Hill. Next, we have Tom Sigathy. Tom Sigathy, Associate Dean of Students and Director of Do-Well, joined the Duke family in 2008. He obtained his Bachelor's of Science in Mental Health from the Franciscan University in Ohio and his Master's in Counseling with a focus in child welfare from St. Joseph College in Connecticut.
Next, we have Nahal Kaivan. Dr. Nahal Kaivan, the Academic Dean and Co-Director of the Spire Fellows Program, earned her bachelor's degree in psychology and Spanish from the University of San Diego and completed her master's degree in psychology from Pepperdine University. Dean Kaivan earned her PhD in counseling psychology at Washington State University. Next, Dr. Jeff Cully, the Associate Director and Director of Clinical Services at CAPS, joined the CAPS staff in May of 2001 as a staff psychologist and coordinator of alcohol and substance abuse services after earning his PhD in counseling psychology from the University of Texas at Austin. In 2007, Dr. Cully was promoted to coordinator of clinical services. And finally, April Autumn Jenkins, who is the Gender Violence Integration Services Coordinator at the Women's Center. Ms. Jenkins earned her undergraduate degree from Hudson-Tillotson University and her Master's of Social Work from North Carolina State University. Over the past 8 years, she has educated students, faculty, and staff at numerous universities on Title IX, as well as the prevention of and response to dating and sexual violence on college campuses. With that, we will turn to our first question, which is following up on last year's mental health forum. We aim to inform students about the mental health resources that are available at Duke. Let's start with Dr. Cully, Deans Powell and Sigathy, and Ms. Jenkins. Could you please take a moment or two to briefly describe your respective resources, CAPS, Duke Reach, Do-Well, and the Women's Center, and answer the question, in what ways are these resources best utilized, and how should students approach the process of seeking mental health support at Duke?
Well, I can begin since I represent CAPS. The services that we offer a range of services. All of them are not necessarily treatment services. You don't have to have a diagnosis or mental health condition to utilize our services. But we try to offer a range of services that would help people with everyday life kind of challenges like stress and anxiety, on up to treatment of mental health conditions or disorders. We offer workshops, which any student can typically register for, just going to our website. You don't even have to come in for most of them to have an interview or start a record at CAPS even. You can register online to join those. And discussion groups, same way. We have therapy groups that are very popular and really a good fit for most students that come into CAPS. We have health coaching, which a lot of people don't know that CAPS provides to help people with health-related habits. We have individual and couples counseling, and psychiatry. If medication might be helpful or indicated, we have psychiatrists and one psychiatric nurse practitioner on our staff. So we have a full range of services. Students typically utilize CAPS very well. About 18% of the students on campus utilize us in a given year. And the best way to reach us or to initiate services with CAPS is to call. Our phone number is easy to remember. It's 660-2000. You'll be able to speak with somebody at that number who could set you up for an initial phone visit with a counselor at CAPS to talk about your needs and then get you connected to the right kind of service that we have there. You can also check out our website. All you have to do is Google Duke CAPS, and you'll find us there, and that gives you instructions on how to utilize us. All of the services that we're doing now are telehealth. Currently, we're using a Zoom platform, which you're all very familiar with, I'm sure. And I want to make sure that people know also about Blue Devils Care, which is a telehealth service that it's not CAPS that's providing that. It's provided by the university, but it's a service that you can use 24/7. You can find out about it by going to our website. It gives instructions on how to access that service. You can talk to somebody immediately if you need to. You can also schedule visits with a therapist via Blue Devils Care if you'd like to do that. It's also something students can use that are not in the state of North Carolina, which is a beneficial aspect of it.
Thank you. Dean Powell, can you share a little bit about the work done at Duke Reach?
Yeah, absolutely. Thank you. Good evening, everyone. So I work most closely with Duke Reach, or I have over the past 13 years. And Duke Reach is our office within the Dean of Students office, but also part of the Student Wellness Center. And we provide outreach and support to students for a variety of reasons. We receive reports from members of the Duke community. It could be other students, staff, faculty, parents, and students themselves can reach out to Duke Reach to ask for support. And we work to connect students to a variety of resources that exist on campus. Sometimes it's CAPS, sometimes it's other resources, sometimes it's academic deans, sometimes it's off-campus providers. It really depends on the nature of the concern. And so we'll meet with students and talk with them about what's going on and see if we can be helpful in making those connections. We also provide comprehensive case management services to students, and really that means just coordination of care to students for more complex needs or maybe longer term needs, and make sure that students have support throughout their time at Duke. And so, if students really are unsure where to go or are struggling in any way and kind of want guidance on maybe where to receive support, Duke Reach can help with that. I would say there are a variety of ways to get in touch with us. We can be reached via our email at dukereach@duke.edu. We have a web portal for anyone to submit reports. They can be anonymous, although we ask, possible to not send anonymous reports so that we can follow up with the provider and be as transparent as possible with students when we reach out to students. Um, and then when we're on campus, you can certainly walk in and see us as well. We're located in the Student Wellness Center. So lots of ways to get in touch with us.
Thank you so much. Dean Sigathy, could you tell us a little bit about Do Well?
Yeah, sure. Thanks. Hi, everybody. I am Tom Sigathy from Do Well, as you know, and we address services in probably 3 different areas. One is teaching people how to do some risk mitigation. Usually that is around substance use and sexual health. And those are typically one-on-one type style interviews and meeting with students, trying to help students develop harm reduction strategies in order to manage their choices. The second bucket or area that we address is building up wellness promotion. And we do that mainly through a lot of different programs that we're offering and helping our students present different programs that might be focused on areas that they feel gives them a sense of purpose and meaning. And then they offer that to the rest of the community. The idea of those programs really is to assist students to develop ways to manage stress and anxiety at low levels and on the day-to-day. So trying to help people to establish a routine on a daily practice that is going to be positive towards their emotional and mental well-being. Similar to what we often do for physical health around the gym or eating, to have certain practices that are going to help the emotional side. With that, one of the large programs that we do is teaching Koru, which is a meditation 4-week workshop that was designed out of CAPS by a former psychologist there, Holly Rogers. And we help to facilitate all the different people that are teaching Koru across campus and keep it organized, giving a practice to students. The reason that we focus on the meditation so much is research shows us that meditation helps people to manage stress. It increases self-compassion and it increases immunity to disease, which is a very good thing to have during a pandemic. So it has worked very well. The third area that we address really is assisting students and giving back to the community. So a lot of our programs that are hosted by students for students is really an opportunity for students to do just that, which is they learn this material, they grow by it, and then they're able to give back to their fellow students.
Awesome, thank you so much. And finally, Ms. Jenkins, if you could share a little bit about the Women's Center.
Awesome. Good afternoon, everyone. My name is April Autumn Jenkins, and I have a very unique role with the Women's Center. I do therapeutic services for students who have experienced gender violence, as well as do prevention and education around the prevention of gender violence. So when we talk about the resources of the Women's Center, we do very specific mental health sessions, right? Where CAPS with Dr. Cully really focuses on a generalist perspective. We're very focused on trauma-informed care and helping students work through trauma that they've experienced, whether it's at Duke or before they came to Duke, around gender violence, whether it's stalking, sexual abuse, sexual harassment, I'm leaving out one, intimate partner violence. There we go. Sorry. So the services that we provide, we do not have a cap on those. We don't have a session limit. We make sure that we support students. We help them with any accommodations they may need academically, as well as if they need assistance with medication to deal with possible flashbacks or being triggered in class. We make sure we connect them with CAPS to get some medication management as well. So, yeah. Oh, I'm sorry. The way that you can reach us, I apologize. It was listed and I just saw it. The way that you can reach us to access those services is by email, which is the simplest way, which is wchelp@duke.edu. Myself or Sheila Broderick will quickly email you back or give you a call to assess your needs and move forward in the therapeutic process or offering you the options that you might need. on campus. You can also visit our website. If you go into the duke.edu website and Google Women's Center, you will definitely find our site. Thank you.
Thank you all so much for sharing about your respective resources as well as how students can access those resources. We'd now like to talk about mental health and its relationship to the COVID-19 pandemic. How has mental health at Duke been impacted by COVID-19, and what is the Student Wellness Center doing to account for COVID-related mental health concerns? Let's start with Associate Dean Tom Sigathy to discuss this from the Duell side, then we'll follow up with Ms. Jenkins.
Sure. I'm not sure that I'm going to add anything new on this topic because I think everybody obviously has been living through this for a year now. I will say that extroverts and introverts both are being impacted by COVID. I think early on, the introverts probably were saying, oh, this is nice, actually slowing life down a little bit. But I think we've been in it so long now that everybody is being impacted by the level of isolation and lack of social connection. I think that it is showing us in a lot of ways how much we pick up from each other just by being in the presence of other people. There is research out there that I've referenced before by a company called HeartMath, where they have really, by contraptions that they hook up to people and measure the heart rate, they've been able to tell the energy levels that get passed between humans when we're within 5 feet of each other. And what they've proven is that our heart rates tend to align when we are that close. I find it very interesting that it's within 5 feet, since we've all been social distancing to 6 feet or more for the past year, and how much of that energy level that we're not picking up from each other and not necessarily having that connection sense that we as humans need. And that has dramatically increased the level of stress that everybody's been dealing with, and looking at how much we get lost in our own head and in our own thought process that might not always be accurate. I know I can do that when I get very stressed out. It's hard to read people. It's hard to read body language through technology. It's hard to get a sense of who people are through technology because we're two-dimensional rather than three-dimensional. So I think all of those components play into that.
Thank you so much. Ms. Jenkins, in your work at the Women's Center, how has the pandemic impacted mental health concerns pertaining to sexual assault and harassment, as well as traumas related to gender violence? And what resources or services does the Women's Center offer to help?
Great question. So we have definitely continued to see clients during this time. While it has not always been students are being sexually assaulted on campus, because again, we all haven't been on campus as much. But what we're finding is that people are activated a little bit more with their past traumas. So again, we are still offering the same services that we would if we were all together on campus. Again, as Tom has referenced, when we are apart, when we have more time to think about things, again, more activations, maybe triggering. So again, those services are still available. One thing that I wanted to mention that we have, as a campus, have been working on diligently is the COVID amnesty policy around sexual assault. And I see that our wonderful technicians have placed that in the chat. If you look at that website, it really talks about the amnesty that is given if someone is gathering their parties, and if someone is sexually assaulted, what is the amnesty? How will the university move forward and possibly support victims, survivors, and the reporters?
Thank you so much for that. Moving on to our next area of questions, we'd like to discuss the balance of academics, social life, and mental health care for college and graduate and professional students. Dean Caven, in your role as an academic dean and psychologist, what suggestions do you have regarding how students should seek mental health support at Duke and in general?
Thank you for the question, Jay, and thank you, Olivia and Nicole, for having me, as well as thanks to all my esteemed colleagues on this panel with me tonight. So good to see your faces. So I have a few thoughts on this question, and they all sort of start from this idea or this thought around the reality that before there were counseling centers on campuses, there weren't counseling centers on campuses. And what human beings did in those times, I would argue, is less of a Western framework and maybe more of a collectivistic framework of seeking mental health services, because there was a clear collective sense of a group or collective responsibility to mental health on campuses. Now, I'm not knocking counseling centers. I think that they're amazing. That's where I started at Duke University. Our counseling center is incredible. Please go to CAPS. If you haven't been already, just check it out, utilize the resources there. But I would say to students, both undergraduate and grad students, consider broadening your network of support. Because I think that if we look to just one context or location for support, we will likely be disappointed. So in thinking about that, how can we try to amplify our connections to people who might be able to tend to different needs that we have in our lives? So perhaps we have different mentors we connect to on campus, who we might talk to about career aspirations, career goals, but maybe there's different themes or patterns we want to save to discuss with folks at CAPS. So think broadly as possible is the first thing that I would suggest. And then the other thing that I would suggest along those lines is encouraging folks to be really clear on the needs that we have from different folks and who our allies are. So seek those different allies out and understand what are some appropriate things for me to ask of this individual or this person who I'm adding to my network of support, and can they meet that need? So I'm not proposing that we like go to our physics professors and talk about the difference between shame and guilt. Now, we do have many physics instructors on this campus who could hang with that conversation, but I'm not proposing that you do that. More so, maybe I'm going to have a conversation with my physics instructor just about like how to navigate such an intensive course of study in this context, ask them those types of questions that might be more or less more personal and less related to the topic of study. Finally, I tell folks to reach out with abandon, but don't convince yourself of what the interaction must be or how it must look. Of course, there's a lot of hype that's built in every cultural community and context about who this person is. So if Olivia told me that they had this incredible connection with Vice Dean Amy Powell, and they told me about, all the amazing points of that conversation, I would of course believe that happened, but I might also come to expect that we'd have the same type of conversation. But perhaps my connection with Miss Jenkins is going to be different, stronger. That's okay. It's okay for me to know different folks differently on campus. And I always say to everyone, as it relates to resources, asking for connections, always ask. Because if you don't ask, then the answer is no. But you won't know if the answer is really no unless you actually take that step in asking folks, are there resources? Do you have time for connecting in these ways? So think as broadly about support as possible.
Thank you so much. And as a follow-up question to that, how is Duke as an institution addressing the intersectionality of mental health and the different identities that our students have?
Yeah, so I think this is a really important question to be asking all the time. And I like to think about this question less as the type of question that has a definitive answer, because I think that's antithetical to what we want to try to work towards. We want to think about this question as what is the process that we're engaging to diversify, to think more critically, to complicate our own notions of what diversity and inclusion are. So for me, I can answer in my lane in the academic sphere, and I will defer to my wise colleagues about what's going on in their sphere. And I know that so many exciting and wonderful things are going on in their sphere, but I know that for us, we focus on things from the ground up, like hiring folks who look more representative to the student base. I know that was a big impetus at CAPS when I was working there as a staff psychologist, creating a majority minority space. But beyond those things, because we know that identities can also be weaponized in white supremacist contexts, we want to make sure that we're not just saying, okay, I'm a queer Muslim person, so if you want a queer Muslim, we have one of those for you. Let's go ahead and connect you with this provider or therapist, but more so that folks are interrogating the white supremacy that we've all internalized, and doing our work. It dismantling bias of all kinds. And so in the academic sphere, we have ongoing trainings. I feel like our provost erected a symposium like the day after the murder of Mr. Floyd. And we've had ongoing anti-bias and anti-racism trainings. And then specifically within the decanal suite, we have ongoing conversations about anti-racism and anti-bias. So I'll defer to other folks along these lines, but I guess what I want to speak out more than anything is that we don't want to ever say that there is this definitive destination that we're going to arrive at. We want to say that we're constantly in process, and I believe that we're accomplishing that.
Thank you for such a great and thoughtful answer. Speaking of reaching out for mental health services, we received a lot of student submitted questions regarding CAPS and other mental health services available to Duke students. Dr. Culley, could you clarify the maximum number of visits allowed at CAPS for students and speak a bit about some of the myths surrounding CAPS? What options are there for students who are seeking more long-term care?
Sure, thank you for the question. I'll start with actually a myth because I've heard this myth very often. I've had students come in and talk to me either in my office or via Zoom and say, okay, so I've heard that you can only be seen 6 times at CAPS, and then start to talk about why they're seeking services. And it seems to be a pretty widespread myth now that CAPS offers has a 6-session limit where we cut people off after they've had 6 visits, and that's just not the case. And trying to figure out why that has spread the way it has and why the number 6 seems to be the number that folks have settled on. I think it may be because our counselors will sometimes try to tell people as they're framing up how they could utilize CAPS that on average, the students that come to CAPS are seen between 5 and 6 times. And maybe they hear that as 6 is the maximum, or that number just sticks in their head. But that's just an average, and that includes people that come in and see us only once or twice, and then problem solved or issue resolved, and they move on. And we have a lot of students that we see for a longer period of time. Now, what we are is we are a brief agency, and what that means is that we just can't engage all of the students that come to see us in long-term care, or else we wouldn't have availability for new incoming students to get services from us. So we define brief as anything that can happen between that, one single session, good talk, that one, and a person feels better, on up to about a semester's worth of services that we can provide. And if somebody needs longer than that, we can either help refer them out at the point they reach that, end of a semester or roughly a semester's time frame. Or sometimes, we know on the front end that a student is working on something that will take a longer amount of time than a semester. And we may help them with a referral at the front end of the process. Often it's because we give them a choice about that and sort of say, would you rather begin with someone here at CAPS and then potentially have to start over with a new person in a semester's time frame? And a lot of students say, well, I'd rather just start with the person that I'm going to see, because I don't want to tell my story again to a second person. Other students will say, well, I'd rather see what I can gain from being seen at CAPS, and then talk about referral options. And we work with both of those kinds of presentations. Another myth about CAPS is that, just that it's hard to be seen there. It's hard to get in to CAPS. And I'm afraid that's kind of a remnant from the past when we did have wait lists and there were some barriers to students getting in and being seen right away. It's been a long-lived myth or kind of residue from the past, because it's not the case anymore. Currently, we're able to, we see students immediately, and if a student calls, a counselor is available to talk to them virtually immediately. They've got to fill out some forms first, but same day, meet with them, talk with them. And then if we schedule them for services at CAPS, like individual counseling or couples counseling or psychiatry services, we're getting students in within a week, sometimes shorter, sometimes same day of the date that they first call, to begin that service that they're going to stick with for a while at CAPS. So you can get in to CAPS, and we really had tried to make a system where it's easy to access us, easy to be seen at the moment that you're struggling with something, in order to figure out what you want to do about it, and then get connected to the right level of service that we provide. Another thing that, I guess it goes along with the 6-session myth, or you can't get into CAPS, is the myth that, well, CAPS just will refer you out. And that's another one that students have had that experience, certainly, of being referred out of CAPS, being referred for specialized care somewhere else. But it certainly is not the norm for students. We provide referrals to about 30% of the students that we see at CAPS. And of that 30%, half of those, we provide the referrals after we have already provided an episode of care or services to them. So we're not just telling students when they first get there that we've got to refer you out. Most students the service we provide is enough. They get it with CAPS. There are some that get some service with CAPS, and then we realize there's more service that they may need, but they've already gotten an episode of treatment from us. And then about 15% of students might be the ones that we identify on the front end that they need something that we can't provide, and then we help them out with a referral, which shouldn't be diminished in its importance, because we have a referral coordinator, Leah Gilmore, who really knows the local mental health community and can help students get connected with a therapist that's a good fit for them, fits with their insurance, fits with their financial limitations, fits with identity factors that are important to the students. We know that stuff, and Leah helps make really quality referrals for people that need them.
Thank you so much. And moving on to our last question, which was submitted by a graduate and professional student here at Duke. And it reads, I know that there are several groups, researchers, faculty, and individuals working on Duke, Durham, community, and global mental health across disciplines, from psychiatry to law to global health to public policy. Have there been any efforts to bring these people together into a center for mental health at Duke? Several top-tier universities are bringing together the personal, academic, clinical, and advocacy domains to engage in multidisciplinary, multi-sector dialogue. Since mental health is a public good, why don't we do the same? Vice Dean Amy Powell, would you like to weigh in on this?
Yeah, thanks, Jay. I'm actually really excited about this question. So I started in a new role as a Vice Dean of Students this past October. And so while I still work really closely with Duke Reach, I'm also working a little bit more closely with some of our other wellness units, so CAPS and Do Well and Student Health. And in doing that, one of my primary areas of interest is to start bringing some of the amazing work that we do across the university together. As the person who submitted this question noted, we really are a leader in the field in so many ways, and I think we have so much to offer, and we could offer so much more if we were able to bring together, really thoughtfully, not just the practitioners, but the researchers, the faculty, in a way that is, again, kind of being a leader in the field. So, academic affairs, the different graduate and professional schools. And I know, Jay, you and I have had some of these conversations. And part of what I'm doing is kind of going around doing a little bit of a listening tour, and hearing, kind of what are some ways that we can partner together and do things differently. Basque Connections, I think, is a really great example of kind of a collaborative way to start. And we've recently been engaging in conversations with Basque Connections around some ideas with this concept in mind, and thinking about some proposals that we could put forward. So I welcome dialogue and discussion around this idea. I would love to connect with the student who kind of put this question out there. If I'd love to know what those other schools that are doing it great. I'd love to know what they're doing and see kind of how we can do better. So I'm really, like I said, I'm really excited about this question and would love to talk more to others who are interested. Please email me, amy.powell or a.powell@duke.edu.
Thank you so much. And we'll just take if there's any other panelists who'd like to chime in or weigh in on this particular topic before we move on to our breakout rooms.
Well, I will just say that there's a person who's here at this event named Molly Weeks, who's done a lot of research on student well-being on campus, and the Resiliency Project is probably something many of you have heard of, and that has been a collaborative kind of effort that it began as a collaboration between, I believe, the psychology department and CAPS. And has expanded into including Residence Life and other units at the university, and gathered some very interesting and helpful data about students and what drives stress levels and what drives resilience for them. So I guess that's another example, and Molly is here with us this evening.
Thank you all so much. Thank you for your insights and for such an informative discussion. Now we're just going to take a few minutes for a break. So for everyone here on this call, stretch, get a drink of water, and let's come back at 6:45 for our breakout room discussions.